So I'm actually just going to spend about 10 minutes to introduce you all to a very successful and tangible way to strengthen a specific level of human resources in health supply chains. And first, I do want to acknowledge my colleague and friend Naomi Prince, who was not able to be here tonight but helped to put this presentation together. And I'm going to talk a little bit about Zimbabwe and Tanzania, but also mention a few other countries where this activity is working. So a common challenge, we all have questions about the supply chain. Questions that could include things like how much stock is in country? How long is it going to last? What are reporting rates? What's national consumption? How much product is needed to meet our program requirements? What quantity of product is being procured and by whom? When are they coming in and are there any gaps? And who's doing logistics training, when, and covering what material? And who has these answers? That's the question. Who has that information? And I have an answer for you. Logistics Management Unit. A logistics management unit or a supply chain management unit, they're called different things, is a management structure that's responsible for organizing, monitoring, and supporting all supply chain activities within a logistics system. And it can be both a strategic unit and an operational unit. And this diagram here of an integrated supply chain shows you that everyone from customers on the one end over here to facilities, to managers, to manufacturers, all benefit from streamlined processes and visibility of information. And a logistics management unit is just the entity that can do that for you. So I'm going to spend a little bit of time talking to you about the variety of functions that a logistics management unit can perform across the logistics cycle, which Rebecca showed you earlier. So this is JSI's version of the logistics cycle. A lot of them exist in various forms. But a logistics management unit can cover a lot of these functions within this logistics cycle, from data management, monitoring and evaluation, intervention planning, training, capacity building. We can go through all of these. Coordination, collaboration, quantification, supervision. They have a lot of different, could have a lot of different responsibilities depending on the scope. And I'm going to take a few minutes to take you through a couple examples of how logistics management units are operating in a few countries. So an LMU function in action. Logistics data management in Zambia. In Zambia, they have a logistics management unit that sits at their Medical Stores Limited in Lusaka. And one of their many responsibilities is logistics data management. They both receive, review, and process all of the logistics management information system reports from facilities for a variety of different commodities. And they generate feedback reports for each facility so that they can highlight reporting errors so that staff know at the lower level facilities what they can do to improve their reporting rates and therefore improve the quality of data that we're getting up the level of the system. The LMU, as they're called there, tracks non-reporting facilities, so they're also able to follow up immediately. So if a facility didn't report, why didn't they do that? And they can get those reports up. Moving to Zimbabwe, they also share data, reporting data with Ministry of Health and other partners, which is a very important piece of information, piece of data to know, because all of these partners need to know things about the logistics system, all those questions that I had at the beginning of the presentation. Moving to Zimbabwe, they have a logistics unit. The logistics unit in Zimbabwe is a 15-member staff that are situated in 2 different locations in Zimbabwe. And one of their many responsibilities is leading the annual quantification exercise in Zambia. They manage a central level automated system that aggregates and analyzes data that's used as the primary source of information for the quantification exercise. Not only do they lead the annual exercise, but they're also responsible for updating it quarterly and also updating the procurement and supply plans. They also have the authority to manage those supply plans, coordinate arrival, and identify gaps and mobilize resources to fill the gaps in the supply chain to ensure continuous supply. Another responsibility of the logistics unit in Zimbabwe is training and capacity building. So getting it, not only is a logistics management unit an entity of human capacity and human resources to manage the supply chain, they also have responsibilities to instill some of that capacity farther down the supply chain. They have responsibilities to ensure that facility staff have the supply chain skills, knowledge, and tools. So tools like standard operating procedure manuals, all of the reporting forms. They even supply the prepaid envelopes that the facilities use to send their reports up to the system. They coordinate both pre-service and in-service education and on-the-job training. They train supervisors in supply chain management and coordinate all of these supply chain training activities across the different entities within the ministry and partners. Moving to Tanzania, where they have a nascent LMU. They're in the process of establishing a logistics management unit. And due to the fact that the Ministry of Health and Social Welfare in Tanzania is undergoing, like in Namibia, a pretty vast restructuring, and it was seen as an opportunity to consolidate all of the logistics functions into one central agency. And you can see here, I know the text is very small here, but this is with the logistics management unit at the center, but all of these different entities had some kind of logistics or supply chain responsibility. So programs, everything from the AIDS control program, malaria, reproductive and child health, TB, leprosy, immunization, all were either a customer of the supply chain or had an influence in the supply chain. Different divisions within the Ministry of Health, the Food and Drug Authority, their procurement and information and communication technology, implementing partners, and development partners. All of these people have some kind of influence or need from the supply chain, and it was determined that previously all of these entities were working separately. The logistics management unit is the unit and entity that can be the source of information for all of these people. So I've sold you, right? You're all like, this is the way to go. We all want logistics management units. How do we do it? I can tell you that too. So starting an LMU this is a big deal. This is not an easy task. It is, as Benoit said earlier, we're in a kind of a paradigm shift. And paradigm shifts are not easy and aren't something that happen very quickly. And so critical components of starting a logistics management unit definitely are to identify an LMU champion, someone who can communicate that this is something that will be helpful for the supply chain, both for the supply chain functioning itself, but also for the human resource component of it, that there are people dedicated to this task. It's very important to define the functions that an LMU will be responsible for. In all of the countries that I've highlighted, they have a variety of responsibilities. They don't all do everything that I listed. We have in Liberia, after their supply chain master plan that they developed, they created a supply chain management unit, and they just have data management responsibilities for the time being. So you need to define the scope of what it is that they're going to be responsible for. Also outlining the relationships. Where are they going to fit within the ministry? In Ghana, there was a cabinet memo that had to come out to establish this unit, to give them the authority to be able to monitor supply plans and have influence with the different partners. You have to determine the structure, staffing, all of the fixed and recurring operating costs that will be included. Other countries that are in the startup process for logistics management units are Tanzania, as I mentioned, Botswana, and Ghana. I just wanted to end with one last slide on how LMUs, if I hadn't convinced you already, that LMUs strengthen and support supply chain workforces by providing timely and accurate data for decision making, monitoring proper use and application of supply chain management procedures and tools, serve as a structure through which supply chain management practices are institutionalized within a health system, and really elevate supply chain management as a critical component of any successful health system. So that's my spiel, and I will thank you very much for your time and attention.